Today I want to explain how veneer preparations should be performed and what factors determine the amount of preparation required in different instances. Because every case requires a different type of treatment and preparation in the beginning. You have probably seen these terrifying TikTok videos of teeth shaped down to pegs for veneers. But that's not real dentistry. At least, that's not how veneers should be done properly. To be honest, I think that's not even how crowns should be done properly. Yes, veneers usually require some preparation. First, we need to start with the end in mind. Before we begin, we need to plan and design where the new teeth should be located. How we do that is another video subject, and I'm not getting into it in this one. According to the final design of the new tooth locations, there are usually two types of cases in regular veneer treatments: additive and subtractive. As the words explain, in additive cases, the patient's teeth are usually small and we need to add material to make them look bigger or wider. This way, we can properly align them with the patient's face. In these cases, we need to add material to restore the desired final position, not to remove it. But don't get me wrong, even in these additive cases, we still need to create a super minimal margin on the teeth, around 0.6 millimeters. Hence, the veneers sit perfectly without creating a thickness or a step on the teeth that will accumulate dental plaque and help that plaque and bacteria affect the gingiva and teeth. Dental plaque accumulation is usually one of the reasons we don't like to proceed with a prepless veneer approach. That protruding margin will be the area where these bacteria can grow and flourish. That's why we want to eliminate that step. Prep comes in that point. When we think about it, you can easily ask, Dr. Johnson, how can a person see a margin with that precision, like 0.6 millimeters? Like even a millimeter is so hard for eyes to detect. Yes, that's why these type of preparations can be performed under magnification using highly sophisticated loupes or, in our office, a dental microscope. It is tough to see the preparation we put in with the naked eye. In the subtractive cases, we see patients with protruded, long, and or larger teeth compared to our final desired outcome. They're sticking out. In these cases, we may need to remove or reduce more tooth structure than in additive cases. With the subtractive approach, we can create the space required for the final restorations by reshaping or preparing the teeth. Cases with protruded larger teeth, like we discussed, are another limitation for prepless veneers. If the teeth are already larger, protruding, moving them further out will make them look bulkier or larger than before. I'm sure you've seen cases like this from your family or friends. As you can see, the amount of preparation is determined by not only case-by-case basis, but also on tooth-by-tooth basis. In the same mouth, we can see both additive and subtractive approaches together. One side can be protruding out and we may need to move them back. One side is technically smaller and we need to just push them out with our restorations. That's why even in one mouth, we can see different approaches together. In any case, it is impossible to see these extremely invasive preparations like you see on TikTok in an up-to-date dental office like Toronto Smile Design. Even in cases that require restorations with more extensive coverage like crowns, we don't need that much space for thick materials. With advances in dental materials, even super thin materials can resist biting forces effectively. Back in the days, we needed to have thicker materials to withstand these forces. So, preparation in veneer cases is a necessary evil. Your duty as a patient is to find a dental office where they can prepare teeth minimally under high magnification. Even better, find a dental office which can design, plan, and simulate the end result without you committing to the treatment. Because not every case can be treated with veneers. Knowing all these benefits, risks, and different possibilities will give you the peace of mind you're seeking for. But the best advice I can give you is please, please, please do not rush. You need to know that nearly all treatments we provide you will be with you for decades. And you must naturally love them, love the outcome. Also, you need to be able to function and chew with them comfortably. Take your time and do your due diligence before you commit to any treatment or any dental office, including ours. Even with our level of technology and sophisticated team, unrealistic timelines like teeth in a day or teeth in a week are usually extremely invasive. Even in laboratory part of the treatments, we can miss a lot of things if we try to accelerate the natural production phase of the treatments. Recently, with the increase in so-called dental tourism, we have been addressing complications arising from fast-paced treatments in other countries. Usually fixing something that is broken becomes more complicated and more expensive in the end. The initial goal was to be more reasonable in pricing. It's more expensive in the end. Also, unfortunately, the outcome of a complication that is fixed cannot be as impressive or successful as treating the same case from the start with the right foot in the first place. Okay, that's enough information for this video. Thanks for watching and see you in the next one.